Hi everyone, my name is Dr. Uri Burstyn and I'm a veterinarian in Vancouver, British Columbia. And wait, I'm not doing that intro anymore. You guys know who I am. This is Mr. Pirate and he's here to talk to you today about what you can expect when your cat comes home from an anesthetic. Now, Mr. Pirate is a very educated kitty. As we all know, cats read by sitting on things with their butt, and Mr. Pirate has sat on all of my textbooks and notes throughout vet school. So he basically has an honorary vet degree, and he's eminently qualified to speak on this topic, having undergone anesthesia multiple times himself. And of course, I will act as his interpreter. Oh, Claudia, you're here too. Claudia will be joining us as a transient audience member. Please excuse the tail. So this video is being made in collaboration with the Meow Passion blog, which is a website blog focused on distributing high quality information to pet owners. It's really good info and fun stuff to read for anybody who loves cats. I can't really say cat owners because that's not really an adequate description of us. Cat butlers is already taken, so let's say feline associates. So check out the Meow Passions blog. There's a link in the description below. Hey, Mr. Pirate. Hi, are you ready? And let's get into it. To understand what to expect when your cat comes home after an anesthetic, perhaps it'll be useful to understand what an anesthetic is. So when we say that we're going to give your cat an anesthetic, what we're really saying is we're going to give your cat a bunch of drugs. And those drugs are going to serve two main functions. One is anesthesia, so lack of sensation. It's going to shut down brain activity to a point where they're no longer aware of what is happening. Two is analgesia, which is blocking pain pathways so that whatever is happening, because chances are it doesn't feel too good, doesn't produce pain signals that reach the brain, which prevents the patient from feeling pain both under anesthetic and, more importantly, after they wake up. So usually we do anesthetics when we have to do something that's uncomfortable or painful, such as surgery, or maybe something that requires our patient to stand still for a long time, such as dental cleaning or an MRI, or sometimes it's just given when what we're planning to do is very stressful for the patient, and for them not to be aware of it is actually in the interest of animal welfare. But point is, it's a really routine tool used in medicine. Anesthesia is widely considered one of the most important medical inventions of the 20th century. And certainly anyone who has a cat in their life will probably experience a cat coming home from anesthetic at some point. Recovery from anesthesia is basically the process of those drugs that we gave your cat leaving the body. And there's a couple of things that dictate the speed at which those drugs will leave the body. One of them is the drug choices. Some, like Alfaxin, last 10 minutes. Others, like ketamine, might last for 8 hours. So the drug choices dictate the speed of recovery and the quality of recovery from anesthesia, but so does the patient's status. You know, a young, healthy animal is going to recover from anesthesia much quicker than an older one that has medical issues. Blood pressure and blood perfusion to the brain play a big role. Body condition plays a role. So there's a bunch of patient factors as well as drug factors that determine how quickly a patient recovers and what their experience during recovery will be. So there's a couple stages they all go through, however. The first stage is usually when they're just waking up, usually within a few minutes of anesthetic being finished. And typically as a pet owner, you'll never see this, but basically there's some firing in the brain. They're starting to move around, but you know, the light's on, but nobody's home. Like, they're not conscious, not aware. They'll often vocalize during this period. They'll thrash around, roll around, they're kind of throwing themselves about. Humans do this as well. Apparently, a lot of humans wake up from anesthesia strapped down to the gurney so they don't knock over the IV stand or hit a nurse. And then just by the time they wake up and fully conscious, the straps have been removed. So there's a period of involuntary movement and just kind of thrashing around and really not being quite right. I really hope that Claudia's little ear isn't distracting you guys too much. Oh yes, Claudia, groom yourself in front of the camera. Very good. The next stage, and this one you might see, let's say the anesthetic was done late in the day or if some slow acting drugs were used, is that of a cat who is, kind of awake and aware, but just not quite with it. And typically what you see is a lot of stumbling around. They'll stumble around. They'll also often perform repetitive pointless motions, like they'll swing their head side to side, or they might walk, turn around the kennel over and over again, or walk to one side of the room and walk to the other one, kind of stumbling around and bumping into things. At that point, they're basically like your drunk friend on Friday night who's had one too many and isn't quite sure where the door's keys are. So And this period can last for like 8 to 12 hours. So really important is that when you take your pet home from the vets, and if they look kind of funny and they had an anesthetic that day, it's normal. It's to be expected. There's no really avoiding it. In some cases, and you really, you shouldn't panic. I do occasionally get calls from owners who are like, seem kind of incensed that their pet isn't quite right when they got home. And if anybody's actually had anesthesia themselves, you know that that day you're not going to be yourself, and maybe not even until the next morning. So when your pet comes home, treat them like a drunk friend. Set them up somewhere warm and cozy where they can't fall down the stairs or fall off of anything. Something like putting a cat bed in a walk-in closet, or if you have a big dog kennel, you can put a cat bed in there with like food and water and litter, and just let them sleep it off. Make sure they have some quiet and some peace. Let them sleep it off. They'll probably be more or less normal the next morning. That's a normal anesthetic recovery. That's what you can expect when the pet comes home. They look like, Jimmy Bob on Saturday night. Because pets are usually fasted before anesthesia, they'll probably be quite hungry the evening of, and it's kind of an old-fashioned thing to do, to not feed animals till the day after they have the anesthetic, to like starve them that evening, or to give them like half a full meal and a full meal the next day. It's totally pointless, does no good, and is actually kind of mean to the animals. So unless there's a strong indication for food restriction, like they had gastrointestinal surgery done, they should get fed the same day, and probably fed a lot. They'll be very hungry when they wake up.
You're such a chumpa wumpa pirate. The hungriest cat ever.
And if a cat can keep its head up and walk around, they have the swallow reflex, which means it's safe to feed them. There's no concerns there, unless the specific surgical procedure they were under carries special concerns with it. So don't starve your cat that they have anesthetic. There's no reason to do that from the anesthesia alone. So usually just offer them a big meal, water, they can eat or not eat as they wish. And of course, they probably want to use a litter box. They'll often pee a lot because when they're under anesthetic, there should be an IV fluids. If anybody suggests putting your cat under anesthetic without IV fluids, you should take your cat back and go find a real doctor, because no veterinarian who knows their craft would ever put a cat under anesthesia without IV fluids. Mark my words. If a veterinarian tries to do anesthetic on your cat without IV fluids, unless it's something like a cat neuter, which is a gray zone, don't let them do it. So they will always receive intravenous fluids, which means they'll be really well hydrated, which means they probably won't drink a lot because they're very, very well hydrated, but they will probably need to pee a lot because they're very well hydrated. So make sure they have a clean litter box, and don't worry too much if they don't drink water a lot in the day or two after the anesthetic. But just basically treat them like a drunk friend. Give them food, give them water, give them a litter box, let them sleep it off. They'll probably be right the next morning. Now, another thing to remember is that chances are whatever happened under anesthetic is probably painful, so your pet will probably be going home with some painkillers. And painkillers often have sedative side effects. Certainly buprenorphine and gabapentin, which are the most commonly used cat painkillers, do cause mild sedation. Not profound, but mild. But they can summate with the effect of the anesthetic drugs that are leaving their body. So again, the painkillers that you'll probably be giving the evening that they come home from surgery might make them sleepy, might make them stumble around a bit, walk like they're a little drunk, because they are. Don't worry about it. That's all normal. That's expected. That's a part of the process. And even a couple of days after the anesthetic, well, the anesthetic's completely clear. Your cat might be a little sleepy if they're getting like morphine for post-operative pain. Again, that's normal. That's to be expected. Don't panic. Although your veterinarian should always be available for you after anesthesia. Certainly, if you do have concerns, you should just reach out for your vet. Don't try to figure it out on your own. Don't look it up on the internet. Don't wait and see to see if things get better. If you actually have concerns, phone your vet. Talk to them about it. They'll be very happy that you did, because every veterinarian wants the best for their patients. And if your vet's not available and you're really worried, then you should have a phone number for an emergency facility handy so that you can reach out. Most places in the world now have 24-hour emergency clinics where there's vets and nurses available on staff all night long. And you can always phone them and say, hey, my pet had this surgery done this morning. This is what I'm seeing right now. It's 2 a.m. Should I come in, or is it okay to wait till 8 a.m. when my vet opens up? So you should know where your local emergency facility is and have their number handy and reach out to them if you're concerned. But a little bit of sleepiness and stumbling around is nothing to worry about. So, and basically, aside from whatever effects of painkillers that you're giving your cat may be, the next morning they should be back to just themselves. So let's say they had a dental cleaning, so no pain, nothing, no extractions, nothing interesting, no painkillers to go home. The next morning they should just be a normal cat, probably just slightly happier than they were before the dental cleaning. And speaking of which, I do have a video that shows you the step-by-step process of a dental cleaning, and anesthesia is actually a big part of that. So you actually get, if you want to see what actually happens during an anesthetic, you can watch that video. I don't have a specific anesthesia video on my channel yet, but if you look at a dental video, which shows Sir Lancelot getting a cohat or complete oral health and treatments, you'll see the actual practical steps of anesthetics. And I also have a few cute, dopey, cats waking up from anesthetic photos on my Patreon and in other social medias. So if you follow me on social media, you'll probably see some of those as well. It can be pretty cute. So I hope that this gives you guys a pretty fair notion of what to expect after your cat comes home from an anesthetic. Claudia, come here. Let's sign off. Claudia, the little troublemaker. Claudia will be absolved of all her sins during this taping by joining me to say goodbye to you guys. Thank you very much for watching. Join us on Patreon if you can. Follow me on Instagram at ArbutusWest. I think that's what it's called. I know, I have an Instagram account. You can just find it through my YouTube channel. Please like, subscribe, share, and I'll see you next time. Oh wait, stuffonmycat.com, one of my favorite websites on the internet. That's your bonus for watching this late.